Good morning, Professor Ho. Thank you for joining us today. Your recent study published in the Journal of Attention Disorders explores a novel brain imaging approach for adult ADHD. Can you tell us what motivated this research?
Good morning, and thank you for having me. Adult ADHD is often undiagnosed and untreated, partly due to challenges in diagnosis. While structural and functional changes in the brain have been documented, we needed a more practical diagnostic tool. Our team investigated functional near-infrared spectroscopy, or fNIRS, which offers several advantages. It's non-invasive, quiet, economical, and tolerates movement better than traditional MRI. We wanted to see if fNIRS could distinguish adults with ADHD from healthy controls.
That sounds promising. What exactly did your study involve?
We recruited 195 English-speaking adults in Singapore, 75 healthy controls, 75 medication-naive patients with ADHD, and 45 medicated patients. During the study, we used a 52-channel fNIRS system to measure brain activity while participants performed a verbal fluency task, where they generated words beginning with specific letters. This task is commonly used clinically to evaluate frontal lobe function, which is known to be affected in ADHD.
And what did you discover?
The results were quite significant. We found that prefrontal cortex hemodynamic response, essentially blood flow changes indicating brain activity, was significantly lower in patients with ADHD compared to healthy controls. Using frontal region measurements, we achieved 75.8% accuracy in correctly classifying patients with ADHD and 76% accuracy for healthy controls. This demonstrates that fNIRS could serve as a potential biomarker for adult ADHD.
That's an impressive classification rate. Did medication make any difference in brain activity?
Interestingly, contrary to our initial hypothesis, we found no significant differences in brain activity between medication-naive and medicated patients. The medicated patients had stopped their medications on the day of participation, which may have influenced this finding. This aligns with some recent fMRI research showing limited acute effects of methylphenidate on prefrontal cortex activity. However, medicated patients did show a slightly higher mean value in the frontal region, so further research is warranted.
What are the clinical implications of your findings?
This study provides further evidence for the biological basis of adult ADHD by demonstrating diminished prefrontal cortex activity. If validated in larger studies, the fNIRS-VFT paradigm could offer a short, non-invasive, and economical assessment tool to aid in diagnosing adult ADHD. Unlike EEG, which has shown inconsistent results across studies, or SPECT scans that involve radiation, fNIRS strikes a practical balance for clinical settings.
Professor Ho, thank you for sharing this groundbreaking research with us. It sounds like fNIRS could truly transform how we assess and understand adult ADHD.
Thank you. We're optimistic about the potential, and we look forward to advancing this line of research to ultimately improve care for adults with ADHD.